Bones of leg, that is the tibia and fibula articulate are three joined. Superior tibiofibular joint, middle tibiofibular joint and inferior tibiofibular joint. Superior tibiofibular joint, it is a synovial joint of plane variety, articulating surfaces. Small rounded flat facet of head of fibula articulates with the similar facet on the lateral condyle of tibia. Ligament, the articulating surfaces are united by the fibrous capsule. The fibrous capsule is further strengthened by anterior and posterior ligaments. Movements. Superior tibiofibular joint permits the slight gliding or rotatory movements. This movement helps in adjustment of lateral malleolus during movements of ankle joint. Blood supply by inferior lateral genicular branch of popliteal artery. Nerve supply. Superior tibiofibular joint is supplied by nerve to popliteus and recurrent genicular nerve. Middle tibiofibular joint. This is fibrous joint. The shafts of tibia and fibula are connected to each other by interosseous membrane. The membrane is attached to the interosseous borders of tibia and fibula. The fibers of interosseous membrane is directed laterally downwards. In the lower part, the interosseous membrane is continuous with the interosseous ligament of inferior tibiofibular joint. The main function of middle tibiofibular joint is to bind the two bones of the leg together. It also provides additional surface for the attachment of muscle, so anterior and posterior compartment of leg. It presents two openings. A larger opening in the upper part for the passage of anterior tibial artery and vein. A smaller opening in the lower part for the passage of perforating branch of peroneal artery. Relations. Anteriorly, it is related to contents of anterior compartment of leg. It includes tibialis anterior, extensor digitorum longus, anterior tibial vessels, deep peroneal nerve, extensor hallucis longus, peroneus tertius. Posteriorly, it is related to tibialis posterior, flexor hallucis longus. Blood supply by branches of anterior and posterior tibial arteries. Nerve supply by nerve to popliteus. Inferior tibiofibular joint. This is syndesmosis type of joint uniting the lower ends of tibia and fibula. The bony surfaces are connected by interosseous ligament. The interosseous ligament is continuous above with interosseous membrane. It connects the medial rough surface of distal end of fibula with the rough lateral surface of lower end of tibia. Anterior tibiofibular ligament covers the interosus ligament anteriorly. Posterior tibiofibular ligament is stronger. It covers the posterior aspect of interosseous ligament. Its lower part is known as inferior transverse tibiofibular ligament. The inferior transverse tibiofibular ligament extends from the malleolar fossa of fibula to the posterior margin of articular surface of tibia. This ligament helps in deepening the socket of ankle joint. During dorsiflexion of ankle, the inferior tibiofibular joint permits slight movement to assist the lateral rotation of lateral malleolus. Blood supply. It is supplied by perforating branch of peroneal artery and malleolar branches of anterior and posterior tibial arteries. Nerve supply by branches of deep peroneal, tibial and saphenous nerves.